Today we'll be talking about acute tracheobronchitis, an acute inflammation of the mucous membranes in the trachea and the bronchial tree. Introduction. Acute tracheobronchitis often follows an upper respiratory tract infection, most commonly from a viral cause. Viral infections weaken the body's resistance and can pave the way for secondary bacterial infections. That's why early and adequate treatment of upper respiratory infections plays a huge role in preventing tracheobronchitis. Pathophysiology. In this condition, the mucosa of the trachea and bronchi becomes inflamed and starts producing mucopurulent sputum, meaning sputum filled with mucus and pus. Common bacterial culprits include Streptococcus pneumonia, Haemophilus influenza, Mycoplasma pneumonia. Fungal infections like Aspergillus can also cause tracheobronchitis, though this is less common. To identify the exact organism, a sputum culture is necessary. Tracheobronchitis isn't always due to infection. It can also be triggered by physical or chemical irritants such as smoke, dust, or inhaled gases. Clinical manifestations. Early on, patients usually report a dry, irritating cough with a small amount of mucoid sputum. As the illness progresses, symptoms worsen and can include sternal soreness from coughing, fever or chills, night sweats, headache, and malaise. Later, as the infection deepens, patients may develop shortness of breath, noisy breathing, inspiratory stridor and expiratory wheeze, purulent sputum. In severe cases, blood-streaked sputum due to mucosal irritation. Medical management treatment depends on the cause and severity. Antibiotics may be prescribed if there's bacterial infection or purulent sputum confirmed by culture. Antihistamines are usually avoided because they dry secretions and make mucus harder to clear. Fluids are encouraged to thin secretions and make them easier to expectorate. If secretions are copious and difficult to clear, suctioning or bronchoscopy may be needed. Rarely, in severe cases where respiratory failure occurs, endotracheal intubation might be required. Most of the time, treatment is supportive. Moisture is especially helpful. Cool vapor therapy or steam inhalation eases irritation. Moist heat to the chest can relieve soreness. Mild analgesics may be used for pain. Nursing management. Nursing care is often delivered at home since most cases aren't severe enough for hospitalization. The nurse's role is to focus on bronchial hygiene, encourage increased fluid intake, teach and reinforce directed coughing to remove secretions, encourage the patient to sit upright frequently to make coughing more effective. If antibiotics are prescribed, stress the importance of completing the full course. Remind patients to balance activity with rest. Fatigue is common, and overexertion can cause relapse or worsen the condition. Summary. To wrap up, acute tracheobronchitis is usually viral in origin, but may become bacterial or even fungal. It presents first with a dry cough, later progressing to purulent sputum and noisy breathing. Management is largely supportive, with fluids, moisture therapy, and good bronchial hygiene. Antibiotics are reserved for proven or suspected bacterial cases, and nursing care emphasizes secretion clearance, rest, and adherence to therapy.